We have to find real solutions, and this is Bending the Trend. Hello and welcome back to Bending the Trend podcast with your host Norm Volsky. And today we are thrilled to be joined by Kristina Ewing, the Director of Health and Wellbeing at Shoestring Valley Holdings. Kristina, welcome to the pod.
Thanks. Wish I didn't bring my boxing gloves, but
Well,
ready to go.
no need. We are fighting rising healthcare costs together, so we're not fighting each other. We're fighting on the same team. Kristina, you and I met at UPowered Symposium, and we shared, a strong passion for employer fiduciary duty and driving cost savings, for employers, for employees. So first question I will ask, as Director of Health and, Wellbeing at Shoestring, tell me about some solutions that you've offered your employees that you would recommend to others.
Probably the most recent ones, which I think are, they're a little bit newer in concept, which would be direct contracting and direct primary care. Those are some of my favorite solutions that really have the biggest impact, especially for employee out-of-pocket cost. But also when you're looking at, plan fiduciary responsibilities, it also has a tremendous effect on the overall plan outcomes and member health outcomes. So it's not just a nice to have for the members in terms of what it gets them, access, ease of care, no out-of-pocket cost, but it also does really great things downstream, prevents, kind of that inflation that everyone's seeing in the healthcare plan year over year. So those are two of my favorite, although they're a little kind of newer and less utilized, I would say.
Okay, I love it. I'm a big believer that if you can't control the referral, you can't control cost. So kind of walk through what you're doing from a direct primary care standpoint, what you're doing from a direct contracting standpoint that has already just, started to bear some fruit.
Yeah, so we work with Hint on the DPC, direct primary care space. We are a multi-region organization, multi-business unit organization. So we have 8 entities across 3 states. And that's hard to, create all these direct contracts ourselves. So a lot of companies have one location, super easy to do this stuff. Please do it right away if you're not already. But for those companies that have multiple places, it becomes really cumbersome to manage all those contracts. So that's one of the reasons that we partnered with Hint to start that direct primary care in all of our areas. And one of the things that we've been able to do with them is kind of create this playbook, so to speak. We had a training for all the providers that are in our network or that have patients of ours, and a webinar essentially. And we told them exactly what we want them to do if they need a referral for X, Y, and Z. And then that fed nicely into our direct contracting vendor. We use HealthMe. And so they do imaging, they're really specialist in MA, so any kind of orthopedic surgery, but also things like colonoscopies and mammograms, which normally are free under health plans anyway. But if you can get the same thing for less, whether it's free or not for the member, why wouldn't you do that, right? So it really is utilizing DPC not just for better prevention, better kind of health outcomes, but also, like you said, we're managing that referral funnel because they know when they need something outside of that DPC office, their first step is to go to HealthMe, and then HealthMe works to contract whatever is needed. Mental health, whether it's infusions, all these different things. So we've seen some significant savings. One of the most recent ones was $50,000 savings on a surgery.
Wow.
And it was, an ankle surgery. So right in their wheelhouse, MSK. But the patient already had been scheduled for surgery, went to go see their DPC for like a follow-up visit. And the DPC is like, wait a second, like you're supposed to try to use these folks. Let's see what they can do. And sure enough, same provider even, they didn't have to switch surgeons. They just switched locations and got a bundled price with this provider, saved the company $50,000 and the member their entire out-of-pocket maximum. They would have maxed out. So it's not just us, it's not just the employer, but the members are saving significant dollars in this process as well. So really cool to just see exactly how it was supposed to work, the DPC actually intervening when something was already in place. So that was just a real testament to like, this is working how it's supposed to work.
I love it. Any other vendor solutions that you've identified that have been really good value adds for you and your
We have a lot of vendors, actually. We have a lot of vendors kind
which
of
ones
working in
do
the
you
backgrounds. But one of my other favorites is Regenexx, which is an injection-based orthopedic alternative. We've been doing that for a couple years now. Most people don't know about 70% of orthopedic conditions, or surgeons, I should say, can be avoided through using Regenexx, which is your body's own platelets and stem cells. So it's nothing artificial that's being injected. It's your own body's substance right into the site of injury, all the different places, necks, backs, shoulders. And about 70% of people can avoid surgery altogether, which is the whole point, right? You're not having surgery after surgery for conditions. And for us specifically in construction, is most of our entities are construction manufacturing. Opioid use is huge, right? Our people have a lot of wear and tear on their bodies, and our opioids are overprescribed. So if you can avoid a surgery, you're also avoiding exposure to opioids. So it's a huge thing for us, not just saving money. It's quality of life for the member. The recovery is so much easier and faster, and the exposure to opioids is non-existent. So it's a win-win-win, and we pay less, the member pays less. So it's really one of my favorite solutions out there too.
I love it. And what are some of the results? You mentioned like the $50,000 saved on that one surgery. Any other like results from either DPC, direct contracting, or Regenexx that you would just say like, hey, here's the proof in the pudding of not only I recommend them, but here's why, here were the results.
Yeah, Regenexx has a ton of those stories. We've avoided full knee replacements. We've had people who avoided fusions, spinal or neck fusions, which are some of the worst. Even orthopedic surgeons will say they'll never get a fusion. Like, it's one of the worst things you can do if you can avoid it. So they're, just from a quality of life perspective, but also plan wise, like knee replacements can be 80 grand, right? So right there, you're saving roughly 80 grand. The cost of the injections is a couple $1,000s. And that's 10, 20, 30 times a year. So that's pretty significant for those things right there.
I learned in my early years in recruiting on behalf of a good client of mine over the years, Hinge Health, that the greatest predictor of a future surgery is a past surgery.
I know. It's true. Scar tissue, whatever, surgery begets surgery. And so, yeah, if we can avoid the first one, you avoid subsequent. And think about all the, the things that go wrong. Wrong limb gets operated, wrong body part. All these things that you hear about, those are real stories. Like, someone experienced that. Infections and readmittances, all of those get avoided when you avoid the surgery altogether. I sound like I make commission off this, and I promise you I don't. I'm just
I know you don't. You're a U-powered fan, and we're all
yeah.
about like
No, I
trans.
used it myself before we had it on our health plan, and it was expensive, but worth it. And so once I realized, like, it really does what it says, then I looked for a way, like, how do we get this for everyone else?
Wow.
Where they don't have to
You're a
pay.
benefits leader who eats your own dog food. You try it first yourself, and then only then you'll allow your employees to try it. So I really like that. We know a lot of entrepreneurs watch this podcast. So are there any solutions that you wish existed that don't exist yet that might incentivize and motivate like an entrepreneur to build a new company that solves for something that just isn't addressed today?
Yeah, I think, obviously we have direct primary care that's a really good funnel, but outside of that, there's not a really good solution that exists that does all the things that we would want. Like I said, we have a lot of solutions. We basically have a custom health plan at this point, and it can be hard to navigate. People don't always know where to go when. And it's not just, what they need, but also saving them money, right? How do they get the best care, the lowest price? And that doesn't exist. One or something to point them to, okay, here's your scenario. Here is the exact things that Shoestring's plan offers, and here's where you go for this. So without like a human doing it, which is hard to scale, I haven't found that solution that is as robust as what I would have to do for every single member.
Yeah, well, maybe there's something coming. Fingers crossed that, there's a solution that can solve for that in the not too distant future. So again, Kristina, thank you for being like one of these like benefits heroes out there. Thank you for sharing all of your insights and your success, in your current role so that others in the industry can learn from you and we can all learn from each other. So thank you so much for joining us on Bending the Trend. Please keep us posted on all the new innovative things you're doing that the entire industry would benefit from knowing about. So thank you so much.
Thanks, Norm.
Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.